Hi, I'm Elisa Bronfman from the Family Medical Coping Initiative at Boston Children's Hospital, an interdisciplinary program focused on educating families and staff around helping children manage medical situation. The Family Medical Coping Initiative is me, Elisa Bronfman. I'm a psychologist. Annie Banks is the social worker in our program, and Gail Windmueller is the child life specialist in our program. Welcome to our talk today. We have Francine Arnold and Michelle Hudak, ASL interpreters from Boston Children's Hospital, to assist with this presentation. I'd like to welcome Rachel Santiago, who is going to give our talk today. She's a speech and language pathologist, and she's been at Boston Children's Hospital for 14 years. She is committed to helping patients and families have the best possible medical experience through improving communication. She has published articles in books and journals on medical communication. She also consults both in the United States and internationally in Australia, Hong Kong, and England on the topic of helping in service delivery, medical care for children with communication, um, to help with their communication. With that, I'd like to welcome Rachel Santiago.
Thank you. Welcome, Rachel. We are so happy to have you here today to talk about this really important topic. And I'm going to start us off with a question, which is, can you first define what communication disabilities and differences are?
Absolutely. So thank you for having me. I think this is just such a wonderful group, and I'm really, really happy to be talking with you all today. So what's a communication disability and communication difference? So someone with a communication disability may have challenges in their ability to send, receive, process, or understand language, or perhaps a combination of these. And it can be related to the ability to produce speech, to hear, to formulate and use language, or to comprehend or understand the language that's spoken to them. On the other hand, a person with a communication difference does not have a communication disability or challenges in the way they understand and use language, but they may speak a different language, including American Sign Language, or have cultural linguistic differences or a different health literacy level that can make communicating in the medical environment challenging. So a communication difference is more related to a variation in communication style that's different from the current situation or environment. On top of that, at least here in my role at Boston Children's Hospital, I might also work with patients who don't have either of these, but have difficulty communicating in the hospital because of what I call a non-speaking condition. So something caused by many different factors, for example, a surgery or a respiratory intervention that makes using speech difficult, but just temporarily. So a condition that's not a disability or a difference, but just a temporary situation.
Thank you. And so we know that having a medical condition or receiving medical care can be very difficult. And how can it be particularly challenging for patients with communication difficulties and differences?
Yeah, so as we know, communication is a two-way process, right? So if a child doesn't understand what their providers or the other grown-ups in the room are saying, or if the provider doesn't understand the child's message, then communication isn't happening, or it's certainly not happening effectively. So communication is really critical to making sure we know how another person is feeling or what they're experiencing. Um, are they comfortable? Is something wrong? Do they have questions or concerns? Do they need to get someone's attention? Um, are we trying to socialize and play? Communication is baked into all of these things. And so to make sure children understand what's happening or what's about to happen, they also need to understand the information being relayed to them. And all this is tied into how we cope in this setting. So if the grown-ups helping children don't understand these thoughts and feelings, it can cause a lot of frustration, worry, and potentially missed opportunities to provide care that that child needs. And the medical setting is already a little scary, pretty unpredictable. So it's important to give children opportunities to express themselves so that we can respond in the right ways and really keep them at the center of their care. So if a child does have a known communication challenge, or if their communication needs change during their hospitalization, it's important to really let the medical team know, because we want to help children have the best experience that they can while they're here in the hospital. And by connecting with them in a way that really works for them, can help reassure them that we're paying attention, we care about what they have to say, we're here to give them the support that they need, right? So we want kids to feel like this is a safe place that they can return to if they need to, and hopefully be comfortable when they're here. And I think by establishing trust and building rapport with these kids and giving them the control to express themselves in a way that really works for them as an individual, they're likely going to have an easier time coping while they're here.
Thank you, Rachel. And I'm going to pass this now over to Gail. Um, you can unmute yourself.
Thank you, Annie. Um, so it's really fascinating and helpful to understand how important communication is, both ways, for a child to understand and for the staff to understand, medical professionals to understand, and families to understand how the child's feeling. And I was wondering, so how is medical coping enhanced by supporting the communication with the child? Like, specifically,
Yeah.
how can we make their situation better and more comfortable?
Yeah, great question. Well, first of all, children are very resilient. I think that needs to be said, right? But they're also incredibly unique. And I think their coping skills are equally diverse, right? So we know that establishing trust and the ability to like maintain control are two really important parts of successful coping in the hospital or in even just a small medical encounter. But those things really hinge on effective communication. So knowing how a child might cope best means finding out how they can be successful and feel comfortable. And I think with kids being kids, this can change like by the hour, by the situation, of course. So ensuring they can communicate effectively in whatever way works for them. Again, we're giving kids a way to express their needs and exert control and then receive that care and comfort they need. So sometimes that means preparing a child for what's about to happen. I've had a lot of patients who've had an upcoming test or procedure that likely wouldn't have happened successfully if we didn't prepare them appropriately. So for some kids, that means seeing pictures of the environment they're going to understand, the space or the machines they're going to encounter. For some, we create stories about what they might expect and what they can do if they feel nervous or uncomfortable. So almost like giving them the language or the actions that they can do when, things feel out of control or unpredictable. For others, we might create communication boards. So, a page with pictures or text that they can point to, that they can bring to their exam, for example, so they can exert control, make decisions, express their feelings, and, ask questions in the moment or in the thing that's happening. It's sometimes these small interventions that make a huge difference to get the child to actually participate and tolerate the procedure because they've been well prepared and they really understand what's going to be happening. I think it's also important to point out that people communicate in lots of different ways, not just by using speech. At Boston Children's Hospital, as we already said, we have an inpatient augmentative communication program with full-time speech language pathologists, and we specialize in supporting patients' communication. So we can be consulted if a patient is here in the hospital during an inpatient admission, and we can evaluate what they might benefit from to communicate to the best of their ability. So we always meet kids where they're at. If they use certain methods of communication outside of the hospital, such as, sign language, physical communication, communication tools, gestures, other strategies, what have you, we can help them, be successful in those modalities while they're here. And then, of course, if their usual strategies or methods of communication are not accessible to them while they're here for any reason, we can make recommendations on tools and strategies to really enhance their communication while they're here. So for example, I recently supported a boy who is non-speaking and uses a communication device, but while he was at the hospital, he couldn't utilize it because of his medical condition, but of course still had lots to say. So my team created a communication book that he was able to access while he couldn't use his device, and he could express how he was feeling, his level of pain, where on his body he was having discomfort. And then his nurses and his family could really respond by assuring him that he could get what he needed to be comfortable and happy and supported. Another example, we recently had an older patient who typically does use speech to communicate, but he actually got a tracheostomy, which left him unable to talk for a period of time. But he also had a neuromuscular disease, so he couldn't use his hands to, for example, write or type. So we set him up with a communication device that he can control with his eyes. And immediately, I mean, like literally within minutes, he was able to tell his medical team that he needed specific approaches to his care, like he had a specific way he wanted to be suctioned. And one of the first things he actually said was, "I'm feeling really anxious. I think I need anxiety meds." Like verbatim, that's what he typed out with his eyes. And then the medical team was able to get him the care that he needed. They were able to consult our psych team and really just set him up for success in that way. We also actually set him up with an adapted nurse call switch so that he could still use the nurse call system and was really, really reassured that he had that control to summon attention if he needed anything, which imagine if you didn't have a way to do that, that could just really re-add anxiety and feelings of worry. So it was definitely a big reassurance that he had that control. It's just a couple examples of like how we can support coping, through communication access.
Well, Rachel, the examples really bring it to life. You can sort of really feel how useful it is just to be able to communicate and be
Yeah.
seen or heard or understood, and also, be able to understand others, the
Mhm.
importance of that for feeling better in medical care. It just can't be underestimated. And thank you for those stories. They really bring it to life. Just wondering what are some general strategies for improving communication in the medical setting, and what can families do to plan ahead if they anticipate that communication may be challenging?
Yeah, I think it's important in response to that to emphasize that parents and caregivers are the experts on their child. They're such a critical part of the care team, and I know I rely on parents to let me know like who their child is outside of these walls, and how I can best support them while they're here. So even if the hospital is new for the child or new for the family, they still have a wealth of knowledge on how they typically support them or how they typically communicate that can sort of inform our approach to care. So that being said, there's a lot families can actually do ahead of time to do what I call communication planning in case communication might be a challenge in the future. So one important step is to make sure that the child has what they need to be successful communicators. So if a child wears glasses or hearing aids or uses a communication tool or device, we want to bring those to our medical appointments and to inpatient admissions if we can. Families can also pack a go bag, which has some of these items, like others including backup chargers, comfort items, maybe extra hearing aid batteries, or other materials that you might need to be successful in the hospital. And the go bag can be prepared ahead of time in case of an emergency, or at the very least, you can have a list that can be saved on your phone or in that designated bag, so that if an emergency happens, you can, quickly refer to that list of all the important items, because we know during an emergency, we don't have time to think about these things. So, I've had patients who anticipated that communication would be challenging, or that using their communication device that they typically use was not going to be really accessible. So they've made backup communication boards or other ideas and packed it in their go bag and always bring it to the hospital. And I've even had patients that are so successful with it, and it's such a quick and effective strategy that maybe they don't normally use day to day, but it's so quick and effective here, they prefer to just keep using it. But if they have something that's really familiar to them and comfortable for them and reliable for them, we want to make sure it's available. Families can also create what we call a communication passport. It's exactly what it sounds like. It's a document that outlines how the child communicates best and what they might need to do that. And then you can bring it with you to your appointments or to the hospital, so the care team can see and read that information. You might include photographs of like how a communication device might be set up, for example, where to put it on the wheelchair or by the bed. And you can do this on your own, or you can have your school or community speech pathologist help you with that. And we actually do have one that the hospital created, and maybe we can link that in the description of the video for people to find. We also want to make sure that if a child benefits from certain strategies, or if there are accommodations that we as providers should know about, definitely let the team know ahead of time. That goes a really long way. So for example, scheduling your interpreters ahead of time, or simply letting your provider know, my child does best if you use simple language, or if you use visuals or objects to show them. These things can really go a long way if done ahead of time, when possible.
That's so helpful. Thank you. That offers a lot of concrete ideas for families to use to help when they come to the hospital. And you did mention some resources, and I was wondering if you could share there's other resources available to help children and families communicate with communication challenges to interact with their medical team.
Yes, I think there's a lot. I will go over some both sort of ideas, but also concrete resources again, that I think are really helpful. But again, I think one of the most important things we can remember is to bring those tools and strategies if we can. So, bringing them to a medical appointment or to the hospital, I just think it's so important. And we can also provide these things. I should say that too. At our hospital, we have a lending library of tools and devices, and we can design and make things that are suitable for any child. But if they have something that's really familiar that they use outside of here, it's a lot less work, right, for the child to think about, okay, I have to use this new thing now. But whatever they need to be successful, if you think of bringing it ahead of time, or designing something ahead of time, or reaching out to us to do the same, I think that would really support communication and coping. So of course, if you are here at Boston Children's Hospital, and if you anticipate there will be a challenge, or if there's some new challenge that comes up, definitely have the team consult our inpatient augmentative communication team, because we are definitely here to help. And I would also recommend meeting with your child life specialist too, because they are the experts on coping, and we work in tandem with one another to make sure kids can really express themselves and understand best to be able to cope best as well. All that being said, of course, not every hospital has the same staff and resources. So if you're not receiving care here at Boston Children's Hospital, it's really important to find out what supports and services might be available. So even though we have a dedicated communication team, I recognize that some hospitals don't. So calling ahead, finding out who might be able to support your child can be really, really helpful. Um, Again, I think letting providers know how to best communicate with their child, super important. And I think being specific is really helpful too. So, for example, my daughter needs you to speak more slowly, or my son can understand everything you're saying. You can speak directly to him. He'll answer your questions by doing X, Y, or Z. Or my child uses a communication device. Give him extra time to tell you what he wants to say. This way, we're really making sure kids are participating, right? And they can do this from a very young age. So there's no prerequisite to participating in your medical encounters. So feel free to advocate for what your child needs and to really let your providers know, because we want to do the best job that we can. And it's definitely going to help us provide good quality care, right? For children who are non-speaking or have difficulty communicating about pain, which is certainly a huge factor to how we cope in the medical environment, there's something called the Individualized Numeric Rating Scale, or INRS. This is a scale that parents can fill out to describe different levels of pain in relation to the child's presentation. So for example, let's say it's a 5-point scale. Level 1 out of 5 means I'm really comfortable, and I might look like XYZ. So for example, a calm state, smiling, content, etc. A 5 out of 5 pain, worst pain level, right? Perhaps a child has certain type of facial grimacing or vocalizations that we can pay attention to, or their body language or their body movements are demonstrating a specific behavior that we want to pay attention to. And that way we're all on the same page. So that's a really helpful tool. In addition to using interpreters, Boston Children's Hospital has something called a family communication board, and it's available in a variety of languages. This was created alongside the Family Advisory Council, Social Work Department, our augmentative communication program, and the patient care operations. So it was really thoughtfully made. And they have quick messages that a parent might communicate with a provider for when the interpreter is not, quickly, readily available, just for quick messages, obviously not big conversations, but things like, I need an interpreter, or I need to speak to the doctor, quick things that families might need to communicate. Again, we have the My Hospital Passport, which is available on the Boston Children's Hospital website, and you can fill that out ahead of time or during the hospitalization, and bring it to the appointment or hospital stays. There's other types of, communication and hospital passports available online. So whatever works best for you and your child, filling something like that out ahead of time is a great concrete way to share that information. So I'm a big proponent for planning ahead, so I love to recommend the passports. I actually have patients who have created these at their school with their school teams, and it's like a huge binder with photographs and information and specific instructions, and just really reflective of who the child is when they're not here at the hospital. And I absolutely love those. Not everyone has time to do that, of course, but any bit of information just makes a huge difference in really enhancing our interactions with kids while they're here. We do also have some communication boards that are free to download on our augmentative communication program website. And I volunteer for an organization called the Patient Provider Communication Network that at Boston Children's we've been involved with for many years. And on their website, which is patientprovidercommunication.org, you can find a variety of communication boards that are free to print and download. Again, not a one-size-fits-all solution. Every child is unique and has individualized needs and things to say. So working with a speech pathologist to explore communication strategies that are really appropriately matched to your child's needs is so important. So, you know, it's great to work with someone who's well-informed to make these kinds of recommendations. Of course, if families feel like they need more expertise in navigating how their child could communicate, whether it's for a, you know, a future encounter at the hospital or just for long term, like for life, you can make an appointment with the augmentative communication program or with other programs in the Center for Communication Enhancement that would meet their child's needs.
Wow, Rachel, thank you for your dedication to improving the communication for all the patients, families, and staff. I mean, it's very inspiring to really realize the importance of communication and how big a difference that can make. So thank you so much for your talk today. And thank you all for coming and listening and watching this presentation. For those of you who are interested, it's going to be on the Family Medical Coping Initiative website, as well as the resources that Rachel described. And then you can feel free to share that with friends, family members, teachers, medical providers, so that they can also be in the know about best ways to make that communication a two-way street. And also, if you're interested in other talks and resources from the Family Medical Coping Initiative, you can find them on our website, which links to our Boston Children's Hospital YouTube channel playlist. And topics include helping your child get through vaccines and blood draws, preparing for medical visits, adhering to medical advice, in other words, being able to follow those plans that your providers suggest, overcoming anxiety about medical visits, managing persistent pain. We have Rachel Coakley from the Comfortability Program speaking there, supporting siblings of a patient, and also teaching your child how to take medicine. And we are very proud of our handbook on pill swallowing, which goes for young children, as well as a separate one for teens and adults who are still learning how to learn. With that, thank you to Rachel, our ASL interpreters, and everybody for listening today.